Millions of COVID-19 rapid testing kits will soon be heading to local communities, and Governor Charlie Baker is now pushing for these tests to be used over the lab tests. Western Mass News reporter Lindsay Kane live for us in studio tonight with those details. Lindsay.
Chris, one local health expert tells me these at-home rapid tests are not as accurate as PCR testing. But given how quickly cases are spreading, they're a solid alternative for a quicker result.
You could get false negatives with the rapid tests.
Long lines at testing sites across Western Mass are catching the eye of Governor Charlie Baker. He's now encouraging residents to utilize rapid COVID testing kits instead of waiting hours for a PCR test.
Rapid tests are highly accurate at determining when an individual is at their most transmissible period of COVID-19, and they have many advantages to PCR testing, especially at this point in the pandemic.
Governor Baker is sending 26 million rapid at-home testing kits to communities across the state starting in the next 90 days, spreading shipments out through March. With a new push for this kind of testing, Western Mass News is getting answers about its accuracy, and we've learned false negatives have been common.
If you get a negative test, especially the first couple days after being exposed to somebody, that may not necessarily be an actual negative. So it is recommended that with the rapid tests that the person waits at least 3 to 5 days after they've been exposed, maybe, or do some repeat tests. So do it over a few days.
Associate Professor of Pharmacology and Immunology at Western New England University, Clayton Mathias, tells Western Mass News at-home tests will likely read as positive if a person is very symptomatic, whereas a PCR test can detect even trace amounts of the virus. Governor Baker says a positive rapid test does not need to be followed up with a PCR, and the Department of Public Health does not suggest employers require a negative COVID-19 test to return to work after isolation. But State Senator Joe Comerford disagrees.
More is better. And I don't think in our world today, as we battle this highly transmissible Omicron variant, that we should cut back on PCR testing.
With cases spreading across the state, she says having both at-home testing and PCR testing options are key in stopping the spread.
One of the best ways we know to do that is widespread testing so that folks know when they have it or if they've been exposed and know when they're contagious.
Well, PCR tests are found to be more accurate. Mathias also says the at-home tests are a good added tool. But if you do have COVID symptoms, he recommends staying home and away from others. Live in studio, Lindsay Kane, Western Mass News.